The pandemic, as we know, is global. Many of these countries do not have access to the same kind of medical facilities that we have in Europe and the United States. They also don't have the same amount of money to pay for expensive vaccines, for expensive treatments. The globe needs a way to treat COVID, and they need a reasonably priced product. First Signal was created in May of 2021. We are repurposing a generic drug that's been around for 90 years to treat COVID in India and other Southeast Asian countries. First Signal was sort of thrust upon me. I caught COVID. I had available to me a medication developed by a now defunct company for the treatment of oral herpes. And I basically had the serious symptoms of COVID for about 3 hours because the medication kicked in and treated and mitigated all the symptoms of COVID. And so when I got over COVID and realized that I was one of the few people in the world to know that this medication existed, who could get it to market, that's when I created First Signal. First Signal addresses the science of molecular signaling based on a generic compound has been around for over 90 years. And by using microdoses of that compound, we have found a way to treat the symptoms of COVID and treat the symptoms of all other viral infections.
The molecules and cells in our body constantly resonate and signal to each other. This intracell and intercell signaling is how we stay healthy. When our bodies are infected with a virus, the signaling between molecules and cells is disrupted. The symptoms of the sickness, the way we feel sick, is our body's reaction to the virus, not the virus itself. When we correct this molecular signaling, we re-establish normal biological communication, which mitigates or eliminates the symptoms. Correcting the signaling does not eliminate the infection, but we feel better while our body's immune system fights off the infection.
Based on my experience as a CEO, I know that the most important thing that you can do in building a company is build a great team of people. And what I have done is assemble one of the best teams that I can imagine. Now, of the 7 people that are the primary people bringing this product to market in India, all 7 have previously been CEOs of their own companies.
The remedy that we are developing is going to be a very easy to use and affordable and accessible, which should give us the excitement about it. And it's going to come in a bottle as a spray that can just be sprayed into the mouth, and it will then have an effect we've experienced is very, very quick.
The company that was developing this product for oral herpes gave this product to over 30 COVID patients. Anecdotally, every one of them was treated, and every one of them has reported a mediation of their symptoms. And so we are planning to bring this to market in India using the Ayush registration process in India.
The opportunity in India really lies in the fact that there's a great belief in Ayush as alternative medicine. 80% of the population of 1.2 billion people regularly use Ayush as their medical route. And therefore that's a big opportunity because we're going to be introducing an Ayush product, remedy, that immediately can be used by 80% of Indians.
We are prior to launch, but we already know what our product is. We already know how we're going to package it. We already know what we're going to do with it. We have enough funds to get this product registered. What we need is, once we're registered, to be able to roll it out quickly and make it available to as many people as possible. I started First Signal because there's a global demand for a product which will keep people out of the hospital and keep people alive. When this opportunity came upon me, I felt a moral obligation to bring this product to market. I hope that you will join me in this huge opportunity